what would you say that identity realization begins for an individual? Where would you say?
So it's a bit complicated, but the psychological research shows that identity development generally begins in adolescence.
Okay.
So if you look at Erik Erikson's stages of development, we know that identity versus role confusion is something that starts in early adolescence and generally gets resolved in early adulthood. But more recently, we found that there are children who are telling their parents that they're experiencing gender dysphoria. So that it is entirely possible that what we're construing as an identity is in fact probably something more deeply rooted in both physiology and cognitive capacities. So it's not just perhaps simply an identity. It might be something much more. And in that case, it's likely that those early understandings of gender are happening when gender formation begins, which is much earlier than identity realization. And that can happen when gender constancy occurs, when a little boy or a little girl knows that they're in fact a little boy or a little girl, and that happens much, much earlier, probably around 2 or 3.
Okay. So what is your stance on children going through gender transitions and why?
It's complicated because, most of us don't have any type of hormones that would make sex-specific changes to our bodies until adolescence. So lots of children are not going to go through sex reassignments, but adolescents probably will. And I think it's important that we give agencies to adolescents to decide what they want. Of course, there's lots of controversy over that because those decisions, once they're made, a lot of them are not reversible. At the same time, there's a history in our country where people were making decisions about children's bodies before they were even old enough to know what that was. So in this country, there are many intersex children who are having genital surgeries performed on them as early as 1 or 2 days old. Now, the North American Intersex Society claims that no physiological surgery should be performed on a child until they're able to make decisions for themselves. But there are very few regulations in hospitals to know if people are following those rules or not.
Okay. So what is your experience with patient response to the way in which clinical psychology handles their experience?
Are you talking about trans folks in particular?
Yes.
Well, it's an interesting time in our field in psychology because the DSM recently changed the diagnosis of gender identity disorder to gender dysphoria disorder. So some are thinking that that might help how clinicians perceive gender variance. But there are huge divides in the field about the appropriateness of how to work with people who are trans. I personally believe that I take a trans-positive stance in my practice and believe that all decisions should be made with the agency of the client with as much information as they can have about the decisions they make. So it's a more patient-informed approach rather than a doctor decision approach. But again, this is relatively new in our field, so I bet you if you were to audit psychologists, people would have a lot of different versions of how treatment would progress.
So do you believe that clinical psychology maintains an accurate viewpoint of the trans community?
It's a tough question because clinical psychology is such a huge, broad spectrum. So there are some people who are really embody and live for the medical model, in which case I don't think they're doing very trans-positive work. And then there are other activists who are really trying to transform the way our field understands the trans experience. And there's tons of variability even within. There are a lot of activism going on right now within the trans community to help not only clinical psychologists but also endocrinologists and surgeons to understand the lived experience of trans people. But in general, I would not say that many graduate programs are training clinical psychologists to work effectively in the trans community. I think they're generally people who are specialists in the field that are doing that kind of work.
Okay. So given the ambiguity of the nature of Orlando from Virginia Woolf's Orlando, transition, what are your opinions on Shell's, her husband's sexuality?
I don't know that much about the book to be able to speak to it, but maybe if you give me some background, I could.
Shell is her transgender.
Okay. So I think what you're referring to is sex reassignment surgery, and I am a proponent of sex reassignment surgery. I think in 99% of cases of people who opt for sex reassignment surgery have a reduction in feelings of gender dysphoria. So I do believe that when a patient decides or a client decides that sex reassignment surgery is appropriate, then I do think it's the appropriate course of treatment.
Okay, so in Orlando, he falls into sleep from trances, they call them. So do you believe that these are in fact deaths in Orlando? Is he living multiple lives, or is he just trans and sleeps for several days?
So I think, it's an interesting question about the way the mind works. I think all of us, to a certain extent, live multiple lives. I mean, there's not one of us that doesn't live with some type of identity contradiction. All of us do. So this is one of the reasons why I think we're so fascinated as people of the trans community, because I think all of us have questions about our own gender, and it makes us curious about the trans experience, because I think all of our genders are a lot more insecure than we think they are. And the idea of sleeping for days could also be considered a dissociative experience. And disassociation happens to all of us. I mean, if you're bored in a class and you look like you're paying attention, but you're really thinking about what you did Friday night, that's a normative form of disassociation. So I'm not as familiar. I mean, I read Virginia Woolf many, many, many years ago, so I can't tell the specifics of Orlando, but I can say that back to your question, I think it's pretty normative that all of us live kind of contradictory lives.